As we mentioned previously, there are different categories of ATC codes that vary according to the complexity of the classification. We'll want to examine each one of these codes to gain an understanding as to how the ATC dictionary works and some of the options that we have to use, as well as how to search for ATC values to assign while we're coding drugs. Let's begin with simple ATC assignment. Remember that one of our guiding principles of ATC coding is that only one ATC code will be assigned for each route of administration. For example, pharmaceutical forms with similar ingredients, indication and strength will have the same ATC code. So when the administration options and use of indication are narrow, we expect only one ATC code for a compound. One example is linagliptin, a DPP-4 inhibitor antidiabetic. If we browse for linagliptin, we will see that we have a list of options for ATC codes, primarily driven by the usage of the drug and the substances that use that drug. Example, Tradjenta. Linagliptin belongs to the group of diabetes medications called DPP-4 inhibitors. It works by increasing the amount of incretin released by the intestine. Incretin is a hormone that raises insulin levels when blood sugar is high, especially after a meal, and decreases the amount of sugar made by the body. We see we have only one option, A10BH. We only go down 3 levels on ATC coding because another guiding principle is that we avoid a 4th level when only one compound will be in that level, based on indication and administration. We can get more information on the drug through the dictionary when common ingredients are also listed. For example, formoterol. Formoterol has a large number of results driven by substances using the ingredients formoterol or formoterol fumarate. Formoterol is a beta-2 antagonist used as a bronchodilator for use in asthma and other respiratory ailments. Selecting formoterol fumarate, we see the list of drugs that use that ingredient. We can then scroll to our desired drug without switching tabs and directly select Oxys. We can then also directly select Oxys and its ATC code. Again, with only one ATC code available, we know that it's taken by an inhaling device to act quickly in the lungs. We can now see ATC coding for drugs with simple ATC code values is relatively straightforward. In other scenarios, we have a compound that may be applied to more than one indication. But again, our guiding principle is only one ATC code will be assigned for each route of administration and indication. This time, since we have multiple applications for the compound, we also expect multiple ATC codes. Let's look at duloxetine. Looking at our synonym substance list, we have a relatively long list of substances we can select from. But in this case, we vary by indication. If we're dealing with a major depressive disorder, we may expect the patient to be taking Cymbalta. we see antidepressants listed, but let's say we're actually dealing with urinary incontinence. We may expect the patient to be taking Yentriv. And we could code this instead to urologicals. Note that we do have to consider the indication very closely, as Cymbalta may also be used for diabetic neuropathic pain, so analgesics could also apply for Cymbalta. In this case, it's useful to have the related case or event information available to us to make such a determination. Having a coding system where ATC coding is performed in line with the drug coding is more efficient because of the availability of relevant qualifiers. But we can also have or see a variance in the number of ATC options we have based on the indication as well. Let's look at heparin, a compound commonly used for blood clotting. When we look at the ATC codes for heparin, we see that we have 3 ATC classifications from which we can choose. But if we were interested in a topical heparin, say like Hydroid, we now see 7 different ATC codes. We may choose heparins for heparinoids for topical use, third option, if we're interested in increasing blood flow to a certain area. Or we may choose anti-inflammatory, first option, if we were more interested in treating subcutaneous muscle pain from a sports injury. Another example of using ATC codes is when a patient takes multiple types of medication for the same indication. Let's examine the case of osteoporosis. Here, the patient may be taking multiple medications for the same disease. For instance, vitamin D, probably a calcium supplement, or estrogens. Finally, we may also see that there are several ATC codes for different administration forms and therapeutic uses. We saw this already with heparin, but when we step through the topical form of heparin, we were more focused on the different indications of the topical forms. If you recall, we also saw that the topical form had 7 versus 3 classifications based on the topical versus the injectable form of heparin. We can see this also with prednisolone, which is a steroid that can treat many diseases and conditions, especially those related to inflammation. It's often used to treat chronic illnesses such as colitis, multiple sclerosis, and arthritis. It may also be delivered in multiple routes. As an antidiarrheal, it may be delivered as a rectal foam, A07EA01. We can see now that we're dealing with the alimentary tract A and an antidiarrheal 07. As a hemorrhoid treatment, it may be delivered as a rectal suppository, C05AA04. Here we can see we're dealing with a vasoconstriction, 05, of the cardiovascular system, C. As a decongestant, it may be delivered as a nasal spray, R01AD02. Where we see we have a nasal preparation of a corticosteroid, 01, for respiratory system, R. As a treatment for the inflammation of the eye, it may be delivered as an eye drop, SO1BA04. Where we have ophthalmologicals, S01, or for inflammation of the ear canal with an ear drop, SO2BA03. We have otologicals. In any event, the compound remains prednisolone. So we can see that ATC codes can vary based on the breadth of application or of the underlying compound. Sometimes it's quite straightforward, but we only have one indication and administrative route like we saw with Tradjenta and Oxys. But we have also seen that there may instances like Cymbalta where we need to know the indication to make the correct classification. It's useful to understand related treatments for the same disease, like with osteoporosis, or be aware of the alternative routes of administration, as we saw with heparin or prednisolone. Though it may be complicated to conduct ACT coding for some of these compounds, using a coding application where ATC coding is managed in line with the actual drug coding allows for relevant information like administration route, indication, and ATC classification values to be readily accessible. With the information readily accessible, ATC coding is much more efficient and more accurate when classifying the drug.